If the federal government does not sign any more pharmacare funding deals, Ontarians would be left without coverage for contraceptives and some diabetes medications. Health advocates say the move would make access for Canadians dependent on a postal code.
Particularly at a time when we're looking at increase in job losses, when we're looking at an increase in living expenses. Cutting access to medication isn't the right move. It's in fact incredibly dangerous.
Last fall, the Liberals and NDP passed the first phase of the Pharmacare Act and signed deals with BC, PEI, Yukon, and Manitoba to cover those costs for 4 years after the Trudeau government promised to roll out a national coverage plan.
Our plan to make common contraceptives free will mean that for 9 million Canadian women, freedom of choice will truly be free.
9 million was the government's estimated number of women who were uninsured or low income at the time, while 3.7 million people in Canada living with diabetes were promised universal access to a suite of medications that reduce the risk of serious health complications and improve quality of life.
Do you see this as a broken promise by the Liberals?
To some extent, yes, because the Carney government did run on a platform suggesting that they would carry forward the agreements.
But today, the Carney government would not commit to signing any more agreements. We will continue to protect the 4 signed pharmacare agreements and the Canadian Dental Care Plan, said a spokesperson for the health minister. For Organization Action Canada for Sexual Health and Rights, access to contraception is key in realizing a number of public health goals and empowers people to plan their families their way, creating a positive ripple effect.
They are better positioned to continue their education, have better employment opportunities, which in turn has positive impacts on their income, their mental health, their family stability, their children's well-being, and it does save the government money.
The Minister of Health maintains our new government is discussing with our provincial and territorial partners how we can support them for better health outcomes for Canadians. But the province's Ministry of Health is singing a different tune, saying Ontario has yet to receive any information on the federal government's proposal since they passed their bill. In Toronto, Mackey, City News.